Hello, everyone. And this is Chai Chat and Community. Before we start tonight, and I introduce you to my guests, Dr. Nisha Khot and Dr. Amita Sarkar, I would like to acknowledge the traditional custodians of the land on which I live and work and pay my respects to their elders, past, present, and emerging. Hello, Nisha. Hello, Amita. Thank you for joining.
Hello.
Hi.
Before we start, can you please tell us something about yourselves? Amita, let's start with you.
Sure. Thank you for inviting me on this forum, Saleha. It's really a privilege. And thanks,
Thank you for
Nisha.
coming.
I'm a clinical psychologist and I'm from India, northern part of India. The journey of my profession started from University of Lucknow, where I studied psychology and really felt that there was a fascinating connection between how sometimes our mind can be our biggest friend or biggest enemy, how sometimes it can go against the person, or sometimes it can be a huge advantage to who we are. And from there, I was interested in the difficulties and challenges around the mental health issues and the emotional problems people face. That was the starting point where I joined National Institute of Mental Health and Neurosciences in Bangalore in India and did my degree from there. I've lived in other countries afterwards, living in India quite a few years now. Primarily, I worked in UK in National Health Services and also with the family law, family courts around child protection, separation, child custody cases, and later on moved to Australia via Singapore. So I've worked in Singapore for 6 years in Children and Women's Hospital, and also having my own private practice. And currently in Australia, I live in Melbourne. I work as a independent practitioner in private practice. And that's my journey in terms of who I am professionally. Um, just to kind of give you a little bit more information about myself, who I am, I come from a huge family, and I really value what family brings to your life, and that also links with my professional thinking because I am trained and work with systems, the families and couples and children and families. In my own time, I would say I like to travel. I can't travel anymore now. So these days, in the past few years, I've picked up just traveling in my own world, in my thoughts, in my emotions. So I'm like a closet poet and writer, which I'm
Wow.
professional, but that's something that I enjoy, and people who have read it, they also enjoy that. So that's who I am. And music is another thing that's part of my life. There's music in the household, and also I like to listen and sing.
Wow. So, you're so talented. Wow. Nisha?
Amita, you really are very talented. My only talent is catching babies. That's all.
Huge one. Huge one.
Very
Huge
important.
talent.
So
Circle
I'm a
of life.
Melbourne
You
based
bring, yes, you bring new life.
I'm a Melbourne-based obstetrician. I currently work both at Western Health, at the Joan Kerner Women's and Children's Hospital, and also at the Royal Women's Hospital. My journey is similar to Amita's. I trained in India in Pune University. I am a grandchild of Pakistan refugees, partition refugees, and my grandmother was essentially studied up to primary school, but she had great ambitions for all her children and grandchildren. And she was the kind of baby whisperer. She whispered into my ear when I was a little girl, "You will be a doctor." So here I am, a doctor. She whispered in my brother's ear, "You will be an engineer." He's an engineer. And so on. The story goes that she was the baby whisperer. I really enjoy what I do. I I have this clear memory of being a medical student and seeing this woman who was brought in, from the village. She was almost at death's door and she was pregnant. And I can remember her. She must have been about 16 or 17. And she was married
Wow.
to a man who to me looked about 60. I don't know how old he was. And I can remember this man very clearly saying to, I was only a medical student, so he was talking to the senior doctors, and he clearly said, I don't care if she lives or dies, but my child should not die. And hearing that made my heart stop. And I thought, how can this be right? How can a woman's life have no value in our society? And that is what actually egged me on, that I thought, whatever else I do, I will make sure that I do women's health, and I will make sure that pregnant women get the best possible medical care that they can in pregnancy, and make sure that they have good outcomes. So that was my reason for choosing to do obstetrics and
Wow.
gynecology.
I'm getting all shivers just listening to it.
I still, when I think back, I get shivers. I get goosebumps all over thinking about how that felt to hear. Similar to Amita's journey, I've worked in India, then moved to the UK, and then moved to Australia. I've been here for the last 10 years. And I describe myself as a feminist, and I describe myself as an accidental activist because, in those middle years of life, you just have children, you have your career, you're so busy, you don't think about anything. You just assume that the world around you will change and be a
Yep.
better place for the next generation. And then you wake up in your 40s and think, what? Nothing's changed.
Yep.
And that, I think, has spurred on that activism and feminism in me.
Great. I'm already getting comments, and I'll show you before we delve into a lot of questions. Amita, this one's for you from Rupali.
Thank you. Thanks, Rupali. Good to see you here.
Swati watches my programs. Thank you for watching, Swati. Love to see these professionals joining forces for this convo. Yeah, Swati is this amazing young lady who came to my show a few months ago. So, Amita, fifth lockdown. And we don't know if the lockdown is going to get lifted because of what happened yesterday. People don't want to get vaccinated, and yet, they are the super spreaders. I don't know whether they are or not, but who knows? We'll get to know tomorrow or day after. So, are you seeing these lockdown affecting women's health, and are you seeing a spike? And how do you suggest, let's say, women cope? I think everybody is affected, but we're talking more women today. So let's talk about women's health. And are you seeing a spike? How would they cope?
Yes, certainly. That's true, Saleha. Lockdown after lockdown, and here we have seen fifth lockdown. There are some countries who've been in lockdown for months and almost more than a year now. It's really a situation where world seems to have shut down. So the schools, offices, shopping malls, there's no place we can go to. But I really think there is only one system which cannot shut down and which hasn't shut down at all, and that's our family, that's our house, that's the home. And the person, primarily the woman of the family, is the one who, in most of the cases, I would say there are exceptions, but majority of the time, it's the woman in the family who takes responsibility of making sure everything is going fine. So the school has come in online schooling, means the kids are at home all the time. Working from home, that's like a new concept, but that also means that the whole family is there, and especially the families who haven't got a huge place to live in.
Yep.
Pretty much everything has really launched into your own living rooms. I was just looking at the statistics around the world. So when we think about women's role in the family, in the household, generally on a daily basis, there is about a bulk of unpaid work. And when we call it unpaid work, what it means is house chores, traveling, looking after children, caring for people who need care in the household, all other things which are not part of your employment or business. And a daily quantity of unpaid work in the whole world is 16 billion hours. And it's really interesting to know that women do 2/3 of that as compared to men who do 1/3 of it. But in the coronavirus time, so the ratio in some ways is like for 1 hour of unpaid work a man does, a woman would do 3 hours of unpaid work. But during the COVID situation, it has kind of nearly doubled. And a lot of women in a lot of countries have really reported working perhaps 4.5 to 5 times more work around the house chores, looking after children, caring for the family as compared to their male counterparts. And you can imagine that the level of pressure it puts on them. Unpaid work has been an important aspect of this lockdown because that has sustained the system around people can work from home, children can study, people can still carry on doing some kind of near normal lifestyle or at least earn the wages. The other side of effect of that is many women either they have been working 24/7, like getting up 5 o'clock in the morning, prepare the meals, prepare breakfast, get the child to sit in front of the online schooling portal, laptop, get to a meeting that they have to attend, take care of the lunch timing, put the laundry on, all the kind of back and forth into the work and life, work and home. Or on the other hand, there are a number of women, especially like the statistics from UK and USA, that there are about 30% of women who decided they don't want to go back to work, either full time or completely kind of just ending their employment status. So financial cost of it. And there are these different ways where we can say that in some ways, if we look at it, women have been the real COVID warriors in that sense. The other part of how we consider why women are quite affected during the COVID situation and lockdown is 70% of healthcare workforce tend to be female. So majority of nurses, healthcare staff, a lot of women work in aged care facilities, nursing homes, support staff like cleaning, laundry, all the other things that go around the healthcare. There are a lot of women employed in that. And those are the other group of women who actually have juggled with the responsibility of facing COVID as frontline workers, as well as really taking care of their home and families. So, just briefly looking at what are the important aspects why we have to consider women being really affected by the lockdowns and COVID and coronavirus situation is physical health wise, there is statistics that men are more affected. There are more deaths, more infections of coronavirus among men. But mental health statistics shows that women are more affected by the COVID situation and COVID lockdown, as well as all the other things that have happened around them. When we look at the reasons briefly to touch upon what could be a possibility, why would we say that women are more affected? Biologically, women are more susceptible to stress, anxiety, depression. So there are high levels of anxiety and depression around COVID. And that is one of the possible reasons we can say that there's more perceived helplessness amongst women, and that creates more anxiety. Trauma and grief. So the trauma around suddenly facing a situation, the world is at war. It's a very unprecedented situation which none of us imagine will happen in our lives. And also women who have suffered from any trauma in the past or who have been in a very difficult situation, such as like women in difficult relationships under pressure due to domestic violence, their trauma and grief has triggered even more during the COVID situation. Also, the implications on the families, so job losses, unemployment, financial problems, all that impacts on the woman because that creates the trauma around facing adversities in life, but also the grief, the loss of a lifestyle that we all aspire to have, all dream to have. Chronic stress is another part of how mental health of women has been impacted, and that's about women's role as caregivers, as I spoke about it earlier. But also, the last point, which is really intriguing, is the lack of social support and lack of coping skills for women, because there are, especially in Asian cultures, Southeast and South Asian countries, there is a huge stigma around talking of your mental
Mental
health,
health, yes.
your emotional problems. So pain is more acceptable. I have got a headache, I have got stomachache is much more easily acceptable rather than saying I'm sad, I'm depressed. So hiding your emotional agony, hiding your pain, emotional pain has been a difficult part. But very important to that is amongst all this, women seem to have lost control over their physical well-being as well. And I think Nisha would be able to better
Yes.
comment on how
Thank
the
you.
physical situation has been really compromised.
Thank you. I just want to I'm getting a lot of comments, and as you can both see, so Chris, Bimajan, and Swati, will come to all your comments. Just want Nisha to talk about the physical aspect of it, and we'll go through each comment. So please be patient. Thank you. So, Amita, sorry, Nisha, are you seeing a decrease in women taking care of themselves? Like Amita said, the majority of the women are looking after the families and the pressure is mounting. So, are you seeing that?
So, Saliha, I will start by saying that there is no women's health without the men in our lives being involved. This is not a women's issue. This is our issue. It's an issue that both genders have to deal with, because once a woman's health suffers, the health of the man who she shares the home with also suffers. The health of the children that she's looking after
Yes.
also suffers. So, I want to move away from this thing of women having to take responsibility for themselves all the time, because it is actually a collective responsibility. It's all our responsibility to make sure we are all well. I think as a culture, we have this thing of women putting themselves last. We have always done it for years and years. We have done it, and the pandemic has just made it worse. Now that there are so many more things that are on our shoulders, we are putting ourselves further and further and further down the list. So I've certainly seen women, I look after pregnant women by and large, and definitely have seen pregnant women not coming to their appointments. Part of it has to do with the fear. So, there's this fear of, if I go to hospital, that's probably where all the COVID patients are, and I don't want to catch it, so I
Yeah.
won't go to hospital. The other side of it is obviously that you're not allowed to bring your kids to appointments, which means that you have your kids at home who are being homeschooled. You don't have anybody to look after them because you don't have any family who can look after them. So then you are stuck in this situation of, how do you get to a hospital appointment when you can't do it physically? You can't do it even though you might want to do it. And then comes the third aspect of the guilt of, actually I can't leave my family, I can't leave my chores at home, I can't not cook the dinner, I can't not do all of this, and I come last. So I think it is a collective responsibility. When women need to get to their medical appointments and there are kids at home, well, guess what? The men have to step up and look after those kids so that the women can go to their appointments. It's as simple as that. I say it's simple. I know it's not. I know that men are also struggling. Their jobs are also on the line and they are finding it difficult to get time off as well. But absolutely, that is something that we need to prioritize. We need to prioritize the basic healthcare. I'm not even talking about anything fancy. I'm talking about very basic healthcare. If you're pregnant, getting to all your pregnancy appointments. And if you're not pregnant, getting to things like your breast screening, your cervical screening appointments. Those are very basic things that we should be doing.
And yet we don't do.
And yet we didn't do them before the pandemic. So there's no chance of us putting ourselves first during a pandemic.
I know. Many of my friends don't do it, and when I ask them, it's not important. So, I think we talk about the importance of all these screenings. So bear with me. What I'll do, I'll go through the questions now, and then I have more questions. So this is from Chris. In your experience, have you encountered a difficult mother-daughter relation? If so, how to cope with it? Okay.
Hi, Chris. Yeah, it's a very relevant question. This is about the how the relationships have been affected during the pandemic, because a lot of time we have seen that another part of challenges to the family is young adult children, children who have had moved out before or who are just ready to move out, have to just stay back. They can't leave home, or some of them have to come back because of financial reasons, because of the COVID situation, and not able to kind of really accommodate that. But whatever is the age of the mother or a daughter, intergenerational differences in terms of how the younger generation has been experiencing the challenges of COVID 19 versus how the parent generation, the previous generation, has been experiencing that, is similar but also distinctly different. So, for young people, it's been a time where they have to really confine to the home situation of listening to parents, whatever they ask you to do, sharing the responsibilities, participating in the home chores, participating in kind of socialization, whatever is possible within the household. But at the same time, they have got a virtual world out there. They have got all their friends on Instagram, on Snapchat, social media. That's another world that goes on all the time. And young people, as you know, they are into that 24/7 in a way, especially like when they're late hours, everybody is going to bed. They are kind of vibrant around there. And that has been one of the major issue of conflict between, I would say, mother and daughter, that the mom would say, you have to study, you have to do this, yeah, because there are expectations in terms of your traditional mindset, what you would like your child to do and behave like, whereas children have got their own demands and their own needs and their own social circles in a way. So that has been one of a challenging issue. The other part of when we say difficult mother child relationship or mother daughter relationship, um, I would talk more about the coping part as well later on, but just to say that one of the most important part of how we cope with any interpersonal conflict when we are all stuck locked into one space is to really try and be compassionate towards each other. Just try to be a little non-judgmental. Ask your daughter what's going on in your life, how your day was. Just allow her to talk a little bit about whatever she wants to talk about, and she will then allow you to enter her world. And that's going to really help you make bridges and really cross that boundary where she's not letting you know what's going on there. And I think that's the biggest worry that most of the parents, most of us as parents have. When we don't enter our child's inner world, we get anxious. When we get anxious, we ask a lot of questions and then they get anxious. So it's kind of back and forth. And to break that boundary, the best thing is just go to their level, just try to enter their world through listening. So that's my quick tip to you.
Thank you.
Aleha, I want to add something
Yes.
which is also something that people, parents in our community don't often discuss. These are young people. They're going to want to explore their sexuality. They're going to want to have relationships. And being in lockdown means that they don't have that natural pathway of where they'd be at school, they'd be meeting with other people, they'd be meeting with the opposite sex and be developing those relationships. And so I think we as parents really need to be in a mindset where we can have that conversation with our young people and recognize that their lives are very different probably from the lives that we had when we were their age, and that actually exploring sexuality and wanting to have relationships is a very normal thing at that age. It is not abnormal, it is not ladki bigar jayegi and all of that sort of thing. It is a very normal thing, and we as parents, like Amita said, need to enter their world with compassion, with understanding, with recognition that their lives are just as valid as our lives.
Absolutely. Absolutely. Thank you. And this is from Parvinder, and that was for you, Nisha.
Thank you.
Benjamin Bimajan Yusuf, who was part of this webcast, she's a healthcare professional and she's an advocate for diabetes, says very informative session. So I have a question. I have to read this because it's pretty long. Thanks, Swati. What are the panel's thought on the impact of cultural taboos on reproductive health practices? Nisha, this is just up your straight. Specifically, how
Absolutely.
can we improve the accessibility of information and services for young people from South Asian backgrounds who face barriers to accessing things like contraceptive education or menstrual health condition diagnosis? Okay, so this is all yours.
Absolutely.
Thank
Like
you,
I
Swati. This is
said,
thank you for asking this.
my first of all, my thing is that, even though you may not go to a doctor's appointment as such, there is a lot of information available on the internet. Don't go to Google, go to reliable websites, go to the ONG college's website. It has some really good patient information about all of these issues. In fact, Australia is one of the few countries where we have an endometriosis guideline, which can be read by anybody because it's really simple to read. And so we have really good, reliable, sensible information available on the internet. What often happens is that when you put it into Google, it takes you down a rabbit hole where there's all sorts of misinformation and all sorts of rubbish, and you don't want to go there. So go to reliable websites, first of all. Have a conversation with your GP. Australian GPs are really good. Part of Australian GP training is managing adolescent contraception, menstrual problems, all those sorts of things. So find a good GP, a GP that you trust, and please just leave your child alone with the GP. The GP is very good at talking to your child alone without you there. I
We
will say
don't
this,
do that, do we?
we
We
don't do that.
never do that. We never do that.
We never do that. And I will say this not as a doctor, I'm putting my doctor brain aside. I have a 19-year-old daughter. And when she was about 14 or 15, we went to the GP because she had some period issues. And the GP actually said to me, "Do you want to step out so I can talk to her?" And despite being an obstetrician gynecologist for God knows 20 years at that point, I still felt my heartbeat stop and go, "Oh my God, why does she want to talk to my daughter all by herself? Why not in front of me?" And then I had to, I
Yeah.
had to put my cultural thing aside and go, "No, this is the right thing to do. This is a smart 14-year-old. She knows what she's talking about. The doctor needs to talk to her alone." And so that is my top tip for you. Let your child talk to the GP directly without you being present, because then they will be able to have the conversation that they want. Young people are very smart. They know what they want. They know what information they need. If we just give them the opportunity to have that private conversation with the doctor you trust, you've got to trust the doctor as well, absolutely, but let them have that time, let them have the space.
Um, okay, I'm just reading the question. Contraceptive education. Let's talk about that. That's never talked about.
That's never talked about,
And
isn't
I
it?
think we need to, yes.
Absolutely. It's the top thing to talk about to your children, both boys and girls. Not just contraception in terms of not getting pregnant. I usually say to young people, there are two things. You don't want to either get pregnant yourself or get your partner pregnant. Equally, you don't want to get a sexually transmitted infection, and you don't want to give your partner a sexually transmitted infection. So those are two top things. And it's very important to think about both. Often I will say, if I'm seeing girls, that if you don't want to get pregnant, you need to have contraception that will be reliable. And here's a list of things that is reliable that you can control. Things like a rod, things like injections, things like pills. All three very safe to take. All of them have a set of side effects like anything else. There's nothing that doesn't have side effects, but we can talk through them and find something that works for you. But that is not going to protect you from a sexually transmitted infection. So no matter what contraception you use to avoid pregnancy, you must insist that your male partner uses a condom. And if I'm seeing a young boy, which I rarely see, but I've known GPs who see them, I will say to the boys that no matter what your partner is using in terms of contraception, you need to use a condom, because that is your protection from sexually transmitted infections. And often I think we don't talk about, we never talk about contraception. We absolutely and definitely never talk about sexually transmitted infections. And they're both very important. They're important conversations to have with our children. In addition to that, have a conversation about having respectful relationships. I think that is the other thing that you know,
Which
having
is what I'm
respect.
going to come to. Yes.
Absolutely. And I'm going to actually pass it on to Amita because I think she is much better qualified to talk about that sort of respectful relationship between two young people.
So, Nisha, are you seeing South Asian kids coming up to you and asking about contraception with or without their parents?
So
Uh,
I usually will get a roundabout kind of thing. So if they come with parents, often they will not say anything
which is
because,
why I asked this
yes,
question. Yes,
they will not say anything. But I personally, in my practice, always insist that the parent leaves so that I can have a chat with the young person alone. And I will always bring up contraception. I will always bring up relationships. I will always bring up protection from sexually transmitted infections with them. And then once I've had that conversation with them, I encourage them to try and have a discussion with their parents about it. That is their choice. They might not want to have that discussion. They might not feel comfortable having that discussion, but that is their choice. I will encourage it, but I don't enforce it. And definitely that person's confidentiality is very important to me. So I will not
absolutely.
disclose
Yep,
it.
yep.
That is the one thing I make to them very clear right at the beginning, that this is a conversation between you and your doctor. I, as a doctor, have a responsibility of confidentiality. This will not leave between the two of us. That's it.
I asked because my daughter told me, I think last month, that while I explained to both of them about the good and the bad touch, I explained to them about growing up. I never did tell them about sexuality, and she said she wished I did. And I thought I was pretty open with my girls, but obviously I didn't do it. So I would request. I think sometimes, unconsciously also, the taboos and just the embarrassment of talking to your child, children about contraception, male or female. It's just kind of holds
Absolutely.
us back, don't you think?
Absolutely. And, contraception is one thing. We don't even talk about sexuality. I mean, within our communities, we don't
No,
talk about being attracted to a same sex partner at all. I
no.
mean, it would be
That's
something
a
that we
conversation for another day, a big conversation.
exactly.
Yes, and the acceptance of it all.
Absolutely. But, there's definitely a role for us, like Amita said, as parents to just enter our child's life and validate it. It is just as valid as our life.
And if
Absolutely.
just to add, if it's not something that you feel comfortable as a parent, then often schools can be a very helpful resource because schools have school counselors and children often have mentors, especially in middle school and high school. And as far as I'm aware, even in Australian schools, there are certain curriculums around education around sexuality, education around relationships. And if as a parent you have every right to talk to the teacher and the year head of your child's school to say these are the issues that I have not really explored, or what can I, so they can really give you a very useful resources which are age appropriate and according to the child's development, that they can understand these issues, so it can start
Thank you.
quite early in life.
Thank you. So, messages coming through, Nisha, and another one from Swati, which says, appreciate the reflections and the honesty. Hope more young people see this and see there's hope because conversations are happening amongst elders. Hey, Swati, did you just call us elders? Okay. There is a question from Chris for both of you. As a single woman, is it okay, normal, to not have maternal instincts or not feel like ever getting pregnant?
Absolutely.
Do you want to elaborate on that, both of you? Nisha, you go first. And
I'll go first and I'll say, this whole concept of motherhood being this thing that we must all aspire to is complete and utter nonsense. There is no need to aspire to motherhood. Whatever makes us happy, we should be proud of and we should do to the fullest of our ability. There is absolutely nothing that says that you should have maternal instincts or that if you don't have them, you're a lesser woman. Absolutely not.
thank you.
I just
Amita?
want to say that maternal instinct, this word sounds very fancy, but it's a very, I would say, not a concept that you would go with all the time. Basically, what it means is attachment and care. And you can have caring, attachment, compassionate attitude for anyone in another relationship, with another adult partner, with your parents, with the friend you have, pets you have, even tending a garden, taking care of a plant, helping someone who needs your help. All that is attachment and care and bonding, and that's all matters in life. Doesn't mean that you have to become another, you have to get pregnant to do that.
Thank you. Um, Shrilal has a message for you. Happy to see you here.
Hi, Sridhar.
And Jaya, I just spoke with Nisha about Jaya, who's a president of Indian Care. Parents should try and encourage respectful relationships right from a young age. Um, I know we should, but somehow I think we still have this thing about, every child should get married at a certain age and we need to do this. And we leave our countries of birth and we carry all our baggage with us.
You can
Sometimes
take
when I
the
read,
Indian out of India, but you can't take India out of the Indian.
I'm guessing that's the true for Pakistanis, for Sri Lankans, for Bangladeshis, for all of us. I mean, some of the stuff I read on the women's pages, I'm just horrified. But um,
Where
Chris,
we
sorry.
said that where Jaya said that we should teach children to have respectful relationships right from the start. Part of that is actually role modeling respectful relationships within the house. And we were talking about family violence and things like that. When children grow up seeing that in the house, then it's very difficult for them to have those respectful relationships because they don't know what a respectful relationship looks like. And when we talk about family violence, there's the kind of tip of the iceberg where there's actually physical violence of somebody hitting someone else, but there are so many underlying things that don't make it up to that tip, and those are just disrespectful relationships where there is no respect for the other person and the other person's contribution, where there is no way of helping that person in the house. So the woman who does all of the housework and does all of her job, while the man does his job and comes home and sits on the sofa and watches TV and then goes to bed, that to me is a disrespectful relationship. If that is what our children see, then how are they going to ever know what a respectful relationship looks like?
Yes, family violence doesn't always have to be physical. So, this is what I was going to ask you. We keep reading that family violence has been on the increase with families being cooped up together. And what defines family violence? What would you like to tell them? Because, as I said, and the three of us have had a conversation before. Family violence is not always physical. So there's marital rape, there's coercion. Do you want to just go through some of them for women listening in who don't know, who may think family violence is all about being physical?
Yes, family violence is not at all about being physical. Of course, if it's physical violence, that's very clear it's violence. But things like where you are being intimidated, things like where you are being forced into, getting, for example, dowry, forced into telling your parents that you need more money, forced into doing things that you may not necessarily want to do. For example, you may not want to get pregnant, so you're taking, your contraception, but you're forced to stop taking the contraception because your partner wants you to get pregnant. That's reproductive coercion. That's a form of family violence. Having sex with you without your consent is rape. It is family violence. You may be married to each other, but consent is still consent. It doesn't change within a dynamic just because you are married to each other. And that concept of consent within marriage and rape within marriage just is so difficult to get our head around as a group of people. It's difficult even for people who don't come from our cultures. But people who come from our cultures, it's even more difficult to get your head around this concept of actually, even within a marriage, there needs to be consent. There needs to be that willingness before you have sexual intercourse. And that, I'm not saying by any way, get a form out and sign it or anything like that. But that that is the sort of thing that constitutes family violence. And all of those are things that don't get recognized. We recognize the physically hitting someone, but we don't recognize the sorts of things that can be included in that family violence. And we're talking not just about partners, we're talking about extended family. So within our subcontinental cultures, there is the relationship between the daughter-in-law and the mother-in-law, the relationship between sisters-in-law, and making threats, a mother-in-law threatening her daughter-in-law, a sister-in-law making a threat against the younger sister-in-law, are all forms of family violence. Threatening behavior is family violence. If you feel scared of anything in your house, in your relationships with your family members, that is family violence.
And
Thank you.
more to that,
Amita? Yeah.
at the moderate and lower level, sometimes people don't recognize the emotional part and the verbal part of family violence, and that's like a low-key ongoing thing that goes on in some families. Um, just really disrespectful in the sense of not allowing the person to have a view, a point of view, not include your partner into decision making in the household, making derogatory comments, ridiculing your partner, and a woman going through uh, not having the priority in terms of what they would like in their life. So really making the person secondary in terms of what their needs are, neglecting their emotions, uh, not allowing them to have contact with the outside world, so making a woman isolated. All these are also part of emotional violence, emotional abuse within the family. And that physical violence obviously is more obvious because people see the scars of that, they see the wounds on the body. But the scars on the mind, scars on a person's psyche, is something that's hard to explain. And often these are the times where women find themselves quite isolated, not able to express what they are going through. And the cycle of family violence is the person who is the weakest in the link, the man to the woman to a child, or elderly family members. Sometimes there's elderly abuse going on. It kind of go around and around in circles in terms of whoever is the powerful is taking it out on the weaker one. If children grow up in these environments, it's very difficult for them to understand what respecting other person means. It's not just showing respect, it's also having the person in mind, acknowledging that there can be two people who are different. They cannot be a replica of each other. They have different personalities, they have different views, and they have different needs.
Thank you. I have questions. Chris wants to know. Okay, this is for you, Nisha. I'm sure you can read it.
Yes. Look, I wouldn't recommend that women should freeze their eggs at a particular age. But of course, as we get older, we know that our ovaries only have a certain amount of eggs in them. And as we get older, those eggs are getting older and older, and we run out of them. So my advice is that, of course, some women will have medical conditions and they'll be undergoing, for example, cancer treatment. And then that is a valid reason for freezing eggs before you undergo cancer treatment. But whether at a particular age you should freeze your eggs or not, that's a little bit more difficult to think about. I think it's important to think about the financial implications and the health implications of actually collecting those eggs and freezing them. And for a long term, because if you are 30 and you're freezing your eggs, how long are you going to keep them frozen for? There are a few things to consider. If you really think that is something that you want to go down the route of, go see your gynecologist, they will refer you to a fertility specialist, and you can have a detailed discussion about what exactly the implications are, what the procedure is, and what the costs are, because all of that is important.
Of course. And Swati wants to know. What a great question this one is. Thank you, Swati. Who wants to go for this? You want to take it, Nisha, and then we go to Amita? Or Amita, you want to start?
I'll say a few things quickly, and then I'll pass on to Amita. Like I said, if there is any situation that makes you feel unsafe, unheard, unvalued, that is violence in a sense. It's not physical violence, but it's violence because it is affecting you. And that is the time to ask for help. I can definitely say that in pregnancy, all healthcare professionals who look after you have a mandatory question to ask you if you are suffering from or if you are subject to family violence. And those questions include asking you, are you feeling threatened? Are you abused by anyone at home? Has anyone hit you? Has anyone made you feel unsafe? These are the questions every pregnant woman gets asked in pregnancy. If you haven't been asked, you should be asked. Sometimes, if you have gone to your appointments with your other half, these questions are not asked. Your midwife or your doctor who's looking after you will look for an opportunity where they can get you alone. Some hospitals actually in their women's toilets have stickers, and the midwife will tell you, go get a urine sample, and on the wall there's a note to say that if you are feeling threatened, abused, violence, anything, put a sticker on that urine pot. That is a signal to the midwife that you are telling them without actually telling them that there's something to talk about. So they will make the space for you to be able to bring it up with them confidentially. But if you tell a healthcare professional like a doctor or midwife that you are subject to whatever the situation might be, that doesn't mean that they will get the police involved, that they will get anybody else involved, that they'll get you into trouble, that they'll tell your husband, anything like that. It's literally they are there to help you. They will do whatever you feel comfortable having them do for you. That might be just a referral to a psychologist or to a social worker whom you can talk to, whom you can talk through what you are going through. It doesn't necessarily mean that the police will get involved. So be sure that you will still be safe, that your confidentiality will still be protected, that you will not be put in a situation where the violence escalates.
Um, Sorry, when we talk unsafe relationships, Nisha, we're not only talking about married women. What about
Absolutely.
unmarried women? And because I'm guess,
Absolutely.
yeah, I don't know whether Swati is married or not, but I don't think she is. So I think she's asking um, about
On a
her
more community
contemporary. So
level.
these must be the, yeah, 20-year-olds, and again, as part of the South Asian community, we never ever talk about it. I mean, I got told off by my daughter for never speaking to her about all this. So
Yes, absolutely. Again, it doesn't matter if you're married, unmarried, or what your situation is. Any healthcare professional looking after you will be able to help you with this, whether it be your GP, whether it be, whoever you're seeing. If you're seeing a gynecologist for any reason, if you bring it up, they will help you. But the difference is that in pregnancy specifically, we are mandated to ask the question. Outside of pregnancy, we are not mandated to ask the question. So that's where the difference comes in. When you're not pregnant, you have to bring it up. You have to kind of recognize it. If you're pregnant, then it kind of becomes something that we will do all the time.
thank you. Sorry, Amita, I cut you there.
Yeah, that's all right. And then I agree with Nisha in terms of healthcare professionals have got a major role in terms of identifying, supporting, getting the person the help they require. But the most difficult challenge, as the question you have asked, Swati, is how do we equip the community? Because there is a difference in terms of other people identifying or at least pointing out to the person who is going through challenges of unsafe relationship. And a lot of time unsafe relationship also means what we just talked about, the violence, the emotional violence, the physical violence or sexual violence. Those issues also make the person quite ashamed. So if there is an emotional abuse going on, the woman can feel quite ashamed to express that, to share that with people around them, even the closest friends or the family members. And that's where the role of the community, where the role of other people who are in the life of that woman matters a lot in identifying and really looking for even subtle cues. If you see that friend of yours hasn't been turning up to see other people in social groups, avoiding phone calls, not really there, physically looks sick or looks unhappy, it's always okay just to find a one-to-one time and just say, hey, can I have a phone call? Can we just go for coffee and have a chat? How are you keeping? What's going on? Are you okay? The other part of it is a lot of times, especially young women, when we talk about young women who are not like married or in their 20s in relationships, they may not be able to understand the long standing consequences of being in an unsafe relationship. Sometimes they go with the fantasy of there's initial turmoil and things will be fine, there'll be love, there'll be romance. But actually, they fail to recognize the signs and symptoms of violence, the emotional and the physical challenges they are having in the relationship, whether it's forced sex, whether it's about emotional abuse. And that's where role of the community is to really educate, really create the awareness about these issues. And as Nisha said, it's very important to talk about the difficulties in terms of what it means to go through domestic violence, why it is not okay, why it's not acceptable. So a lot of awareness also helps, but one to one, you have to really get the person to just check in, just ask them, and if they're not comfortable telling you the details, then get them to get help from a healthcare professional. See their GP, see a doctor, see a gynecologist, see a psychologist. Get help from professionals. Because a lot of time, the communities we come from, there's a huge stigma. If
Yes.
one person gets to know, somebody else is going to, my friend's friends will tell my boyfriend's friend, or my mother-in-law will get to know through XYZ. And people are, that's why, quite worried to disclose these issues. So having
Thank
the
And if you are the person somebody is disclosing it to, don't be that person who says, oh, ye to hamare relationships mein hota hi hai, sab settle ho jayega, thoda try karke dekho, give it another month. When you get pregnant, it'll be fine. Once you have
Cook
a
him
baby,
good
it'll be
food.
fine.
Cook him good food is one.
Yes.
Dress up is another one. I mean,
Yeah, yeah.
and we women, I keep saying we women are our worst enemies. We kind of constantly, none of us have the guts to tell another person walk out of the relationship because we won't want to take the responsibility. Okay, there's another question. That is true. Yes.
Yeah.
Thank you, Ropali. Yes. So I, wa- I want to talk about a very, very important subject, but that will be the last question because I want to talk about it in detail with the two of you in September. So, Nisha, do you want to tell our audience about women's health and what are the typical checkups that they need to do from the time they are teenagers till my age or even older? Somebody did say call me as an elder, but so Swati, I'm never going to let you live this down.
I think the most important message I want to give all women and men and everybody else who's on this meeting is that your cervical screening test is something that you should not put off, you should not ignore. Earlier we used to do the pap smear test. That is still the test that is done in many parts of the world, and it was done every 2 years. It involves an internal examination, and it involves taking some cells just from the surface of the neck of the womb and testing them to see if there's any change that would suggest cancer. Now, in Australia, we are really, really lucky that that has changed and it has become an every 5 year test. So, really, we have
Thank
no
God.
reason to not go and have that test done. So, if you are overdue, my one thing that if you take away from this whole thing is check if you are overdue and book that test tomorrow. Your GPs are open. You don't have to go anywhere else to have it done. Go and have that test done. It is a really, really important test. It is the one thing that has shown across the world to reduce your likelihood of dying from cervical cancer, which is a cancer of the neck of the womb.
Yeah.
So please, please, please do it. If you are 50 years and over, you should also be having breast screening. Again, this is something that we don't do very well at all. It's every 2 years. Breast screening across the country is still open. You can book an appointment. It is a mammogram. So it is essentially a x-ray sort of thing of your breasts. It is uncomfortable. Yes, I know it's uncomfortable, but it is the one thing that has been shown to reduce your likelihood of getting breast cancer. So those are my two top things. Get your cervical screening done. If you are 50 years and over, get your mammogram done. Few other things. As people from the subcontinent, we are more likely to develop diabetes. And if you are someone who has had diabetes in pregnancy, that has been your warning bell to say that you are more likely to develop diabetes. Either way, whether you have had pregnancy diabetes or not, it is absolutely vital that you keep testing for diabetes. It doesn't have to be every year. It doesn't have to be a big drawn out process or anything like that. Every 2 to 3 years is absolutely fine. And the fourth thing I want to say is look after your physical health. It is really important to take some time out to be able to do whatever it is you want to do, whether it's a walk, whether it's yoga, whether it's Zumba dancing, whatever it is that you want to do that gets you up and about, that gets you active, is something that is very, very important for you. Don't put 24 hours towards your family and towards everybody else. At least half an hour out of those 24 hours should belong to you.
Thank you. Um, okay, we have more questions. Amita, this one's for you.
Sure. That's very true. Sometimes people want to be positive. Sometimes there are individuals who want to really think in a positive manner, but there are people around them that throw the negativity at them, and that's the difficult part because you are in a relationship. It can be a very intimate relationship, or it can be like extended family or your community where people have all these negative attitudes or negative beliefs about ये ठीक नहीं है, वो ठीक नहीं है, और भी हो सकता था. How you can protect your mind from that is the first important rule is practice self-compassion. We can listen to a lot of things that are going around us, but we don't have to really absorb everything inside us because we deserve better. And self-compassion is just taking care of, I'm important, I deserve to feel good, I deserve to be calm and happy. And that's the message we have to give ourselves, especially in the COVID and the lockdowns when everybody is kind of just stuck in one place, and it's very difficult to find places where you can go away or you can kind of have a break. Just try to give yourself emotional breaks. Just try to give yourself just some time to myself. And I think that's going to be really helpful when you think about how I can move away from the negativity of other people. Secondly, when you say years of negativity, it also kind of starts to play on our mind as kind of affecting us, who we are. So affecting the personality, personhood. And we start to think, maybe I've done something wrong. So all the time, the brain is very sensitive to negative messages. It's very important to really move away from why me. Don't get into the role of self-pity. Or what if I have this? So sometimes there are people say, बीमार पड़ जाएंगे या पैसा चला जाएगा, ऐसा खराब हो जाएगा, and all those negative messages can really make you anxious. So anxiety is sitting at the bottom of all these negative messages. What if? Why me? What we have to do is just move away from that. Every time you catch yourself thinking, what if? Why me? Be aware that you have to just move away and say, what's next? Just take small steps. Just focus on here and now and just go through the things that you have to do in day-to-day life. Moving away from negativity is much easier when you allow yourself what we call in psychology, living mindfully. Just being in the moment, just try to focus on what I'm doing is the most important thing that I have to do. The other way of dealing with negativity is also looking at what are we grateful for. So having gratitude in our mind about other people who are helpful to us and also how we can be helpful to the community, to family, to society. All these issues will trigger the positive mindset in you, and that's the way to counter that negativity. It was a long answer, but I think I have been able to
That
answer
was a
something.
that was a great answer. Swati says she promises she uses the term elder out of respect and not age. Okay, Swati, I believe you. Um, Mudassik, hello, and Jairam Jiki. So here you go. Um, last question of the evening. Um, Nisha, a lot of women don't want to do internal exams. Why? Why do you think? And there is another question that I will attach to it. Another thing that we never ever talk about because we don't talk about these difficult subjects is child abuse. So, and then,
So, yes, most of us women, we don't want to have an internal examination. Let's be honest. No matter what, the internal examination is uncomfortable, embarrassing. We don't want to have it. There's no doubt about it. But for some women, that internal examination, I have found in my practice, is really, really traumatic. And, I will admit that I have not brought it up with women because, I feel like they want their privacy respected. But it often makes me wonder whether they have had some traumatic experience, whether that be as young girls or whether that be through the course of their lives, whether they have been the victims of sexual trauma and some form of sexual abuse, which then makes that internal examination a trigger event that brings back memories of really awful things. And that is what makes it really, really uncomfortable for them. So, if that is the case, you don't have to tell me as a doctor what has happened to you. That is absolutely fine. I completely understand that you don't want to talk about it because it's not something you want to bring up. But know that we as doctors are really compassionate and we care about you. And so if you say that this is really painful and I don't want to have it done, your doctor will help you. They might give you suggestions for, maybe take a couple of Panadol before you come for the cervical smear test, take some Nurofen before you come, or they might even organize for you to have some gas when they do that examination and the procedure that they need to do. But please believe that we are here to protect your best interests. And the examinations we do with as much care and compassion and gentleness as we can. But if you have had a traumatic experience, I would encourage you to bring it up and talk about it, because that way we can help you deal with that in addition to also doing the actual physical examination that we need to do. Absolutely, child abuse is something that we don't talk about. We like to say कि ये हमारे यहाँ नहीं होता, ये Western चीज है, हम अपने बच्चों के साथ ऐसा नहीं करते. But actually, the truth is that there is a huge proportion of child sexual abuse within our communities. Again, just like we won't talk about family violence, we won't talk about this. Hence, we kind of keep it under wraps. बेइज्जती हो जाएगी, all of those sorts of things. We don't believe our children when they talk about this thing. If they come to us and say, somebody has done something or somebody has touched us in a bad way, we don't believe them. And I think first step is to recognize that children don't make this up. Children are always very truthful and honest. And so if your child is telling you something or is uncomfortable around someone in the family or in the extended community, or for that matter, has symptoms, young girls who have itching around their vaginas, if they have a discharge, if they have bleeding, those are all things to worry about. Get professional help. I'm not saying that every little girl who has vaginal itching has been abused. Absolutely, please don't take that message from me. But what I'm saying is that please take your children seriously when they are giving you signs that there is something going on with them that makes them uncomfortable, because children don't lie.
thank you. Amita, how important is it for us to believe in our children? Because, yeah, none of us want to tackle this very, very difficult truth. It happens. Monsoon wedding.
It is a difficult truth, and it's hard to believe, especially because people think that this is not what happens in our households. But also, it brings a lot of shame, and a lot of time people don't want to talk about shameful things because it's hurtful. It's really putting themselves down in front of the society and other people. The most important part here is when we talk about sex abuse in children, child abuse issues. Again, that doesn't come in isolation. That also has another part of emotional abuse of the child, and especially when Nisha indicated about the internal examination. Other than penetrative sexual abuse, there could be other ways of children being interfered with. So one of the very important thing that we have to teach our children from early age to know what are the body parts that are okay to touch or being touched by other people, and which are the parts that are not okay to be touched. And a kiss on the lip, touching the certain parts of the body, or showing certain parts of body, if somebody asks you to do that, it's not okay, because there could be all different levels of sexual abuse in children that can happen without parents even knowing of that. Secondly, look for signs and symptoms. Sometimes children don't know whether it was an abuse, even the younger age group especially, but the child can understand that something is uncomfortable. They don't enjoy it. They don't want to be coerced into being taken in a corner or being kind of adult forcing upon them, and they are scared because the abuser often have a little secret with a child that they shouldn't tell anyone, and sometimes there are rewards or privileges given to the child. But watch out, just observe if your child is showing any behaviors which are out of order, not sleeping well, crying a lot, being very angry, getting resistance when you're trying to change their clothing or getting them dressed, all anything to do with the physical touching. um, just try and understand if there is anything that's not going fine here. So that's an important part as well. And also, supervising your child is important, and that's something a lot of time in our culture people forget to do that, because it's like extended families, cousins, brothers and sisters, भाई का मामा का बेटा है, बहन की बुआ की बेटी, all those things happen, and people just don't imagine these things, which is okay. But sometime in a very playful exploration, children can get into behaviors which are not really okay. A 10-year-old or 11-year-old exploring body with a 5-year-old or 6-year-old. So what we need to do as an adult is really supervise our children. It's important. It takes a lot of our energy. It takes a lot of our time. But we have to really make sure, as just as you hold your child's hand when they're crossing the road, because you don't want them to run down by a car or have an accident. Emotional security, security of providing knowledge, information, and security of providing a safe space within the household is equally important for us.
Absolutely. Yeah.
That's an important role of a parent.
Thank you. I thought this would be our last question, but we have more questions coming up. I was going to ask you this: what's a good time to educate children about this matter? And I'll continue with this question, which says they may not be ready for the conversation as yet. So, what's a good age? I remember telling my girls when they were very young, because every summer they would go to my parents, and it was a joint family. And chacha ka ladka, mama ka ladka, this cousin, that dada, everybody comes. So I told them when I think they were like 2 years old, and I told my mother that anyone my girls say they are uncomfortable with, you will never ever. And anyway, she never left my girls by themselves. So what's a good age?
I think pre-verbal stage, or children when they are very young, like till age 3, it's really constant 24/7 supervision, not leaving your child with an adult you don't trust or you don't know well. But also young children like preschool or 5-6 year olds, you can explain them very well about what are the appropriate touching, what is inappropriate touching, what are the body parts they shouldn't let other people touch, or child friendly language. But again, as young as primary school age, children can be taught about there are ways that we have to keep ourselves safe. So talking about safety on the road, but also safety of our body, safety of ourselves as individuals. What the major difference there is the language that has to be
Yeah,
used.
I
So
was going to say, what language would you
especially
use?
especially if you have a child with a special needs, or child with language, or delayed development. And sometimes there are pictorial ways of, like a body of a doll, or showing pictures and indicating the points and helping the child um, to understand what it means, what do you call a certain body part, and what is allowed and what's not allowed. But again, as long as the child is able to really trust you, tell you, and really call out and say, this has happened. But before that, if you have a safety net of looking after your child or trusting other people who are keeping an eye, I think there's nothing like that. There's no other solution other than saying that we have to really leave other things aside, make sure that we are looking after our children, keeping them safe, and supervising them.
And Nisha,
You
it's
know,
not just
Saleha,
only girls, right? We also
no,
have to look after
Boys
our
as
boys.
well. Boys.
Yes, because
absolutely.
yeah, more and more we get to know how boys are being sexually abused.
Absolutely. And Anuradha says what time is right. We start at such a young age telling our daughters, theek se baitho, aise pair phaila ke mat baitho. All of
That's
these
right.
things we start at such a young age. So surely we can start also telling them all of these things at a young age, and not just our girls, but our boys as well.
Yes.
Children can understand what is being said to them as long as we use the appropriate language.
Is in case parents don't know what language to use, where can they get help? Where can they? Is there are there any resources? Should they talk to the school? Should they talk to the pediatrician? Um, there are mothers who work in aged care services in disability sectors. They need to go for night shift work. What happens? Or yep,
Certainly, there are professionals who can help you to understand that. Early child care centers, even if your child goes to kinder, talk to professionals there, they'll be able to help you. There are books and websites available online. If you Google, you will find in each country, wherever you live, there are organizations who offer these kind of information leaflets or online resources to learn about it. Even going on the say Amazon, you can Google about the toys for children, about knowledge about body parts and reproductive body parts, and sex education. So there are resources out there if you want to utilize that. And secondly, when you say, Saleha, about how to ensure your child's safety when they are going for a night shift, again, that's a matter that the parents have to really decide what is doable, what's not, what are the support systems they have around them, whether they can trust. And if there is any indication of someone in the family or some visitors who are living with you, or even sometimes it's a sad situation, but very close family member, or even a parent can be the abuser, the other parent has got a huge responsibility to ensure that the child is safe, to understand that that shouldn't happen. Don't just put it and shove it under the carpet. Don't deny, because that's the worst thing that will happen to a child, not getting the response, not getting the support when they are going through such terrible experiences in life.
My
thank you.
top tip for resources, Saleha, is sorry, not in COVID, but outside of COVID, every one of us in Australia has access to a local library. Go and talk to your librarian. Your librarian will find the age appropriate books for your child to be able to talk about things like consent, things like good touch, bad touch, things like body parts, reproductive systems. Your librarian is a great asset. Make use of it. Our tax pays for it.
Thank you. Yes, Anuradha says the need is to create about these resources. And thank you, Anuradha. And Lily, thank you for watching. Um, thank you, ladies. This was very, very informative. And I'm sure we are going to meet up again in a couple of months to talk in more details. Thank you for
Thank
joining me
you.
tonight. Thank you for your
Thank you
time.
so
Really
much.
appreciate it. And
Thank
stay
you.
well, stay safe, everybody. Please wear a mask and stay indoors. Gopal Krishna Mishra says, very educative session. Thank you, Gopal. Thank you. Okay, this I have to show. I was going to end the broadcast.
Thank
Thank you
you.
for watching,
Thank
Jaya.
you very much. Thank you.
Okay, bye.